Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. So glad that you could join us today. Many of us suffer from pain, not only periodically, but on a chronic level. Our guest in studio today is Dr. Daniel Twogood. He graduated from the University of California at Santa Barbara in 1973 with a degree in physical education. He's running his own practice now in Apple Valley. He started in 1985, where he discovered the diet-pain connection. He's written 4 books, the latest of which being Chronic Pain, Gone in 90 Days. How are you doing today, Dr. Twogood?
I'm very good. Thanks for having me on.
Thank you so much for joining us today. You have a degree in physical education. Were you teaching physical education in schools, or what were you doing before you discovered this chronic pain situation that you're helping so many people with?
Well, I like many people who are in college, I changed my major probably 3 or 4 times. Mm-hmm. None of them was chiropractor, which is what I am now. Okay. I studied physical education in the hopes of being a coach. And then I got waylaid and went back to chiropractic school, and where my interpretation of what I learned in school is what my job was to eliminate pain. Mm-hmm. And so I started off in practice with that goal, and I learned that by practicing that my techniques and the methods I learned in school worked really, really well for regular pain. And then there was this group of patients, a certain percentage of them, that suffered with various forms of chronic pain that just didn't respond to anything I was doing. And so rather than, the choices are just keep doing the same thing, which is basically what conventional medicine does, more pills, more therapy, more time off of work, etc. I decided that, there had to be an explanation for grown men coming into my office with severe back pain who reported to me that they hadn't done anything, that just the pain started all on its own. So I asked more questions, and I came up with, what you call the diet-pain connection. We assume that physical pain is caused by physical stress, bending, lifting, twisting, falling, etc. Mm-hmm. Then I found out that there's a big, huge chemical component to it, and that is that it's a chemical reaction to specific pro-inflammatory substances. So at first I thought it was a rare occurrence, but as I started looking in that direction, I found out that, no, there were many, many cases, and so I started writing books about it.
When we're talking about chronic pain, are we talking about a pain that, say, happens once or maybe twice every week? Or is it something that is ongoing? You wake up, it's hurting. You go to sleep, it's hurting. And you just kind of start to live with it unless some type of relief is discovered.
Right. Well, there's been many definitions of it, but both of those will suffice. Basically, what we use as a definition now is pain that's lasting a lot longer than we expect. Now, certainly a lot of people want to get better quickly, and they're kind of bummed out when their pain lasts longer than usual. But when it lasts longer, and you can tell there's something wrong. You've had this back pain before, it went away either with treatment or without. Now this time, it didn't go away on its own. Okay. It's not going away. It's the kind of pain that keeps coming back, and it's a nagging pain. And the other definition of the chronic is that you've been to doctors and they really don't know what it is, or they give you a diagnosis that is hopeless, like fibromyalgia or rheumatoid arthritis or just chronic back pain. And so, that's the kind of pain that we're talking about that's puzzling and isn't matching. And the other thing that happens is it doesn't really match what you're doing. Like I said before, you do nothing one day and it hurts a lot, and the other day you do a lot of work and it doesn't hurt. So it's a very puzzling kind of pain.
In all of these years and years of studying, pain and medical procedures, medications, exercises and whatnot, how is it that doctors are still stumped and puzzled as to how, this pain started? And even more importantly, why are they puzzled as to how to stop it?
Well, that's because basically I have simple categories. There's 2 kinds of pain. There's regular pain and there's chronic pain. Okay. Regular pain is the kind that, bonk your head, stub your toe, strain your back, twist your ankle. Mm-hmm. It goes away in a reasonable period of time, usually by itself. We've all experienced that. Pain is the indicator light that comes on that says your body is being injured or stressed or about to be injured or stressed. And so when you put your hand on the hot stove, the pain comes on to say, hey, get your hand off the stove. Chronic pain is the kind that just doesn't get better. And the problem is they're both so similar in the quality of the pain and the fact that they're both caused by the inflammatory process that doctors just keep treating them the same way, only for a longer period of time. But the difference is chronic pain is stuck in the inflammatory mode. And so doctors have their tools they use for that, like chiropractic care, acupuncture, anti-inflammatory drugs, pain pills, etc.
Mm-hmm.
And we're stuck in a mode where we keep doing that over and over and over again. It's obviously not working. It's kind of like trying to put out a fire that's, a campfire. You can put out a fire with water and dirt and it works really well, or you can let it burn itself out. The chronic pain fire is like a fire that's being fed by a leaky gas line.
Mm-hmm.
And so you keep putting water on it, you keep using conventional techniques, and it's not working, because when you finally figure out that there is a pro-inflammatory substance, the gas feeding the fire, then you can solve the problem. You can say, oh, well, we don't want to pour more anti-inflammatory substances on this fire. We want to eliminate the pro-inflammatory. So there's the basis of my approach to these chronic pain conditions, and doctors just haven't caught on to that yet. We still have this mentality in this country that if there's something wrong with you, you have to add something to your system to get rid of it rather than subtract. So my approach is subtract. Find out what's feeding the inflammation, eliminate it, let the body heal itself.
Recently, one of our basketball greats here passed away, Daryl Dawkins. Chocolate Thunder. Now, I was not at the game where he did his first phenomenal dunk and just shattered the backboard. Within the next season, different backboards had been designed. More flexible glass had been designed. The rules had been changed. You had breakaway rims and things of that nature. It seems to me that there are so many things that improve once a problem is found with a little bit of research and a little bit of ingenuity. Why is it that with so many people suffering from chronic pain and so much study being done, why is it that we still cannot come upon something that treats chronic pain?
Well, again, that's the big puzzlement to me too. It's, the foundation of modern medicine is that if there's something wrong with you, a medical doctor is going to take a history, examine you, come up with a diagnosis, do some tests, and then they're going to prescribe something specific for you to swallow. They don't say, you have high blood pressure and high blood sugar, I want you to go take some pills. They write down very specifically what they have to take in order to solve that problem.
Mm-hmm.
So while their approach is to swallow substances that are going to affect a change, they fail to realize that everything else you're swallowing has an effect on you too, either to the point of nourishing you or poisoning you. And you can ask any patient, because I ask them all the time, patients who have migraines and digestive upset, and they've been to all the medical doctors, and I ask them, I said, did they ever ask you what you eat? And they said, no, they never do. So I don't know why that's taboo with conventional medicine, but they're suggesting that you swallow specific substances. Well, I don't know why the leap hasn't been made to realize that everything else you're swallowing has an effect on you. And it's right there in glaring example on TV. If you watch primetime TV and you watch the drug commercials that are inundated on the TV, mm-hmm. all of them are the same. For 10 minutes, 10 seconds, they tell you how wonderful this pill is, and the rest of the commercial is the warnings, the possible side effects.
Absolutely.
And if you listen to the Cialis commercial, one of the side effects is delayed backache. Why doesn't the light bulb go off in somebody's head who's staring at that and go, hey, you mean back pain can be caused by a chemical substance? And that's what I've discovered.
When conventional medicine is saying, hey, swallow this in order to affect a change, your discovery says, hey, swallow this as far as food is concerned, as opposed to this as far as food is concerned, and possibly eliminating medications altogether?
Right. Well, the goal of eliminating medications, because they are all poison to a certain degree, is true. However, when we talk about changing the diet, people always ask me that. They say, oh, okay, I understand now. So what specific foods are anti-inflammatory? What should I eat? Should I eat pineapple? How about green beans? All this stuff. Again, we're stuck in the mentality that you have to add something to this perfectly designed being in order to affect a positive change. It's not true. It's just subtract. So my approach is not, there are no miracle foods to swallow other than the natural foods that exist on the planet. The problems with our health come from swallowing substances that are either allergenic, immune irritating, or toxic. And that's where we come up with high blood pressure, skin diseases, chronic back pain, etc. So it's a matter of figuring out what these substances are and eliminating them, and then letting the body heal itself. So that's the concept that, again, when you look to holistic medicine, people think, okay, I'm not going to take pharmaceuticals. Instead, I'm going to take supplements. My approach is, I don't even use supplements. It's like, no, we just subtract what's causing your problem. Like a person who coughs. You can say, well, let's prescribe a cough suppressant, but when you find out they're smoking 2 packs of cigarettes a day, it makes more sense for them to stop smoking.
Absolutely.
And, they don't have to add anything. Just stop smoking and you will stop coughing.
Now, as we wrap up this segment, I'd like to ask you a couple of questions. The first of which being, as a chiropractic specialist, have you seen more of an acceptance of chiropractic methods in some of the people that practice traditional medicine? That's my first question. And my second question is, in your latest book, Chronic Pain Gone in 90 Days, 90 days, 3 months, many people have been suffering from a certain type of pain for years. And you're saying that it is possible, quite possible, to eliminate this chronic pain within 3 months period, right?
Yeah. So in answer to the first question, personally, I don't see MDs saying, oh, yeah, chiropractic is great stuff. I do see it on occasion, and other chiropractors report that they see it more and more. I think the big motivating factor that's driving patients to acupuncture and chiropractor is not so much that they have a lot of faith in these alternative methods. It's that they realize now that their medical doctors are only going to be drugging them. And they're finally getting fed up with that. Because what's happening with the drugging is that when one drug doesn't work, the pharmaceutical companies are more than happy to make a much more powerful pill. So people have gone from aspirin to Tylenol to Vicodin to Soma to Norco to OxyContin to all the bad drugs. So yes, people are being steered toward alternatives, not necessarily by the professionals, because I still think healthcare for profit has its problems, and one of them is nobody wants to lose patients. So that's the answer to the first question. And the second question, everything that I do is based on my belief and observation that the human body is a really well-built organism. Boy, you can throw it off a cliff and it heals up. We've all seen the healing mechanism happen, and we know that if you cut yourself, it looks horrible. The skin is open. You can see the guts inside. It bleeds. It hurts. It does all that stuff. But you know what? It heals. And so my whole approach is that remove the interference to healing, and then the body will heal. And you look at almost every healing condition, whether it's a broken bone or whatever, will heal within 90 days. The reason I picked 90 days is because some people have symptoms they come into my office with that are caused by a medication they're taking. And for some reason, sometimes it takes a longer time for medication to get out of the system. So, but well within 90 days, you should heal as long as whatever is propagating this runaway inflammation is solved. You eliminate that like the gas feeding the fire. Shut off the gas, and the fire will burn out. Even though it's been going on for years, it'll go out in a reasonable period of time.
Where can our listeners get a copy of your latest book, Chronic Pain Gone in 90 Days, as well as your previous 3 works?
Well, I have a lot of them on Amazon. You can get them there, obviously. Barnes & Noble has my latest book. 2 of my books, one of them is the latest one, Chronic Pain Gone 90 Days, is available in all the electronic forms. You can get it iBook. It's actually the cheapest way to get it is as a Google app. You can download the book as a Google app for 99 cents. Okay. But it's also in iBooks, it's in Nook, Kindle. It's all over the place. So if you just look up my name on the internet, which is Twogood, Twogood, you'll see some of my videos, some of my YouTube interviews, and things like that, so you can get some of this information. But I want the information to be shared so that people realize that there is hope for chronic pain. You know, you just stop the inflammation, like I said, by eliminating whatever's feeding that inflammation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Our guest in studio today has been Dr. Daniel Twogood, chiropractor and author, the author of his latest work, Chronic Pain Gone in 90 Days, as well as 3 previous works. He's practicing now in Apple Valley, California, where he discovered the diet-pain connection, and we've been here today discussing some of the causes of chronic pain and some of the reasons that, well, traditional medicine just seems to be ineffective in an ongoing way. It's been great talking with you today, Dr. Twogood.
Thanks very much.
Thank you. I'm hoping you'll return and speak with us again sometime.
I certainly will, anytime you want.
Thank you much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to our podcast on iTunes.